I love this question because the answer is no and yes. So a little bit of both. As a neurologist, I want my patients with epilepsy to grow up like every other child. And so I want them to be riding the bikes. I want them to be swimming under supervised settings. I want them to be enjoying every activity that other children enjoy. The only caveat would then be looking at the activity and saying, is this activity safe for my patient or safe for my child? And so that's a discussion to be had with the provider based on the patient's seizure types. But common things that we'll say to families, or that I will talk to families about when I make a new diagnosis of epilepsy, is that patients with epilepsy should be observed while swimming or near bodies of water. There should be someone present at all time who's able to recognize a seizure, recognize someone in distress, and to come to the assistance. If that involves a personal flotation device for comfort of the parent and of the patient, then that's what we will recommend. Additionally, we say try to avoid activities that are taller than the child. For example, if a patient has epilepsy, probably the best thing is not that trapeze camp, not rock climbing camp, although there is some safety measures that they can use for rock climbing, and it depends on the type of seizures and how long it's been since the patient's last seizure. But activities at heights in general are something that I caution my families to take more consideration with before they'll consent to that. Additionally, any activities around hot objects or hot water. If a patient has seizures that involve staring spells or alterations in consciousness, the last thing you would want to have happen is that there is an episode while someone's hands are in hot water, or that there is a risk for burn. Another thing that we will caution patients and their families about is driving and about interacting in traffic. So certainly that patient who's 15 and going for their driver's license, or 16 and looking to drive independently, that we always follow and recommend state guidelines, and also have a discussion with your insurance company to make sure that the duration between the last seizure and now is safe enough and long enough that you're not posing a risk to themselves as drivers or to anyone else on the road. But also younger children as well, who typically may be able to follow basic traffic rules and traffic signals, but if there was an alteration in consciousness, might have a little bit of problems crossing the road or things like that. And then in sports, I usually say, if like a lot of parents will ask, what about my son wants to play football or play soccer, which I love to encourage, but on the flip side of that involves a projectile often being hurled at the patient. And so in that sense, we'll just say to the parents, just make sure, like every other child participating in that sport, that they have appropriate protective equipment, and that the coaches may be aware of the situation. With riding a bicycle, I do encourage my patients with epilepsy to ride a bicycle once we've identified what type of epilepsy they have, and once we know they're tolerating the medications well. And basically it goes to the same recommendations that we recommend for any child riding a bicycle, is just making sure that you have the right personal protective equipment, which for a bicycle includes a helmet, and ensuring that the patient is riding the bicycle in a safe environment, so not in traffic, not on a very steep sidewalk next to a cliff, and typically the younger the child, with parental supervision. Kayaking is another good question. Again, personal protective equipment, so helmet. But kayaking then also introduces that element of water, and so I think that would be a discussion that I would encourage patients to have with their neurologist. Because that becomes a question of what is the risk versus the benefit. If it is if it is a passion for one of my patients, and it's been several years since their seizure, and they're going with other people who are trained in basic first aid, then I may feel more comfortable about saying, go ahead, here's my blessing. But a patient who we don't know much about their type of seizures, we don't know how the responding medications, is planning to go solo, I would certainly say holding off on that would be the better choice at that time period.